Um, Dr. Birditt is a researcher at the Institute for Social Research and director of the Aging and Biopsychosocial Innovations Program. Her work focuses on stress and understanding how relationships differentially influence health and well-being over time. The data in her research comes from the Health and Retirement Study funded by the National Institute on Aging, a longitudinal panel study with approximately 20,000 people. This enormous interdisciplinary study focuses on themes such as brain health, personal health, working and retirement, financial well-being, family and social connections. The Health and Retirement Study received a grant of $15 million, one of the largest that University of Michigan has ever received. Dr. Birditt, we're looking forward to your talk, gaining some understanding of aging and the Biopsychosocial Innovations Program, and why couples who drink together stay together. Thank you.
Thank you. It's such an honor to be here today and talk about my research on alcohol use. And I'm going to talk about ISR. Can you guys hear me okay? Can you hear me better now? So I'm going to talk about ISR, where I work, and my program that I run, and a couple studies that I've done on alcohol use among couples in the health and retirement study. And this is just part of a larger program of research in which we're looking at alcohol use among couples. So I'll talk about Aging and Biopsychosocial Innovations Program, that I run, and then I'll talk about why we look at social ties in particular and how important they are for health, and then the implications of alcohol for health. And then I'll talk about two studies, one looking at alcohol use and its implications for marital tension, and another study looking at how the link between alcohol use and how long people live. And then I'll talk about some of the future directions that we're pursuing. So many of you have probably already heard about the Institute for Social Research. It's the world's largest academic social science survey and research organization, and it's a leader in developing and applying new social science methods, and it's committed to educating the next generation of social scientists. And I've been at ISR since 2002. I started as a postdoc, and they kept me there forever, and it's been wonderful place to work. And as part of working there, I developed my own program of research called the Aging and Biopsychosocial Innovations Program, or ABI. And the focus of this program is to understand how stress and social contexts affect health and capitalize on advances in mobile technology and biopsychosocial methods to gain a better understanding of the factors that influence healthy aging. So all of my research looks at people across the lifespan, across the adult lifespan, and with a particular focus on aging and older adults. So first, why do we look at social ties? And many of you probably already know this, that they're very, very important for our survival. We're uniquely social human beings and we rely on each other. Just to give you an idea of how important social relationships are, this is a meta-analysis of research looking at social relationships compared to other types of things that affect health. And the social ties are at the top. And it's basically how many people you have in your life, are they supportive, things like that. And the top three bars there about social relationships predict survival to a greater extent than many other factors that we often hear of that are related to health, including smoking, alcohol use, and even BMI. But what I think about that's interesting about that research is it focuses on the positive aspects of our relationships and how supportive and wonderful they are. But relationships are also very negative, especially our closest relationships. So the research that we've done on social ties, when we looked at close social networks and people that you find the most irritating in your life, are often the closest people. And and we call those ambivalent ties. It's kind of a terrible term, but it means that they're both positive and negative. So the spouse is the most irritating. Followed by other very irritating people are parents, children, and siblings. And when we talk about negative aspects of relationships or tensions, we often are referring to things that happen in daily life. So daily feelings of irritation with each other or interpersonal tensions, as well as overall feelings about our relationships. And we often look at 4 items or a certain number of items, but this is overall, how much do you think this person makes too many demands on you, criticizes you, lets you down when you need them, or gets on your nerves? There's some really common questions that we ask people. And when researchers have compared the negative and positive aspects of relationships, they often find that negative aspects of relationships are more important for health. So when controlling for that positive dimension, negative ties are more important for poor overall. They're related to poor overall health. They're related to greater hypertension. They're related to mortality with stroke-related mortality, coronary events, and even obesity. And when we've looked at negative relationships, we've compared different types of relationships. And this is a study I did with Tony Antonucci that we've been talking about today, who's a very important person, ISR. This is a research that we looked at types of relationships over time from 1992 to 2005, and we compared the types. And the spouse is the most irritating over time. That's the orange line. You can see it's consistently negative. The only other tie that's similar is the mother. So just like, but it's more important to look at spouses as people age, of course, because your mother doesn't live as long, unless she's very, very old. So it's really important to look at the marital context for health and aging in particular. So just some statistics about marriage. 69% of adults over age 50 are married or cohabiting. And marriage provides a really important context for understanding health behaviors. It's because we share our environment with our spouse. We often share the same health behaviors, and we often share the same life stressors. So you're exposed to the same often life stressors with one another. And a lot of the research shows that couples are very similar within their health behaviors. They're similar in their and their well-being. So they're similar often in their depressive symptoms, their sleep patterns, their physical activity, and their alcohol use, which I'll talk about today. And this is particularly important among older adults because they often spend more time with their spouses than they've ever spent before. Because they're retired. Their adult children have hopefully left the home, but sometimes they come back. And older adults can have disabilities that limit their ability to go out of the house. So in terms of alcohol and health, there's a lot of research on the implications of alcohol for health, and I'm sure you've seen a lot of the media attention lately. It's really bad for you to drink a lot. So heavy alcohol use is one of the leading causes of mortality, disease, and disability worldwide. And a lot of researchers are concerned about alcohol use among older adults right now because baby boomers tend to drink more than other generations before. And even someone said an alarming rise is expected in the number of older adults with alcohol-related problems. And this is not only because of generational differences, but there's also aging-related changes in your physiology that makes, for instance, you metabolize alcohol more slowly. You're more likely to have chronic conditions and use medication that might exacerbate the effects of alcohol, or it might just be contraindicated to drink at all, which we've talked about today at this meeting. So just to give some definitions of alcohol use, this is what funded this study that I'll talk about today is the National Institute on Alcohol Abuse and Alcoholism, or NIAAA is what we refer to it. So light to moderate, what's interesting about the levels is that men get to drink more than women until they're 65. So it's light to moderate for men is 2 drinks a day or 14 drinks a week, and you're not allowed to have all 14 drinks at the same time. That's it. And heavy drinking is 15 or more drinks per week for men less than age 65. As soon as men are over age 65, the drinking becomes less. So light to moderate is 7 drinks a week or 1 drink a day, and 8 drinks a week or more is considered heavy. And women, unfortunately, it's always the same. Light, you're not allowed to drink as much. So 7 drinks a week is light to moderate, and more than 8 is heavy. So we look at alcohol use in the context of marriage in these studies, and a lot of the research talks about different patterns of alcohol use among couples, and I'll refer to these patterns. So concordant drinking couples are couples who drink similar amounts. So you could both be heavy drinkers, you could both be light to moderate, or maybe not even drinking at all. So both non-drinkers. And discordant drinking couples drink dissimilar amounts. So one person in the household might be a heavy drinker and the other person doesn't drink at all, for instance. And we looked at the implications of these drinking patterns for marital tension and mortality. And as Catherine already talked about, the HRS, it's a longitudinal study of people over age 50. It's representative of the US, nationally representative, and it follows people and their spouses or their live-in partners over time. And so sometimes people have different spouses as they age, and they follow whoever was in this study before and the new people. So interestingly, only one person has to be 50 or older because the spouse can be younger as they replace. So, and so at any given wave, there are 20,000 people, and over 43,000 people have participated over time in the HRS. And this is just to give a broad overview of the way that it's worked. It started in 1992, and cohorts of people are added over time as they become 50. So it's been going on. It's still going on now. It's been refunded. This is an older graph that goes up to 2022. To look at alcohol use, it's very simple in the HRS. First, they were asked, do you ever drink any alcoholic beverages such as beer, wine, or liquor? And so I talk about that as the ever drink variable. So it doesn't mean that they're drinking a lot, they're just drinkers. And people often, the media is like, couples who get drunk together live longer. That's not true. And then they're asked in the last 3 months, on average, how many days per week have you had any alcohol to drink? And then on the days that you drink, how many drinks do you have? And we multiply those two variables to make an average drinks per week variable. So I'll talk about these two variables. So first, for marital tension, so that there's a few theories in the marital literature. Often there's a lot of studies on alcohol use among young couples in the literature, and they talk about two theories in particular. There's compatibility theory, which suggests that just being similar makes you like each other more, and you're married longer if you're similar in your health behaviors. And then the drinking literature people started talking about this as a drinking partnership. So if you drink and you're a concordant drinker couple, you have a drinking partnership. And the research has found that discordant drinking couples have a lot of negative outcomes for their marriages. They have lower marital satisfaction, greater verbal aggression, and higher divorce rates. So that's what is particularly when there's a heavy drinker and a light or non-drinker in the house, a real discordant couple. And the effects often vary by gender in these couples, the younger couples, with heavy drinking among wives being more detrimental for marriage, and then the discordance affecting wives' opinion about their relationship more than men. Men are not as affected by this disparity in the drinking. And so we wondered whether is this the same for older couples when they're not drinking as much as young couples? And what happens when people are older? Is it more important for them to be compatible? Or do we find the same impact? This is just to give an overview of the sample that was in this portion of the study. In 2006, they started doing this enhanced leave behind questionnaire that asked all the questions that I love about relationship quality and things like that. So this only includes people who reported on their relationship quality in 2006, and then it's given biannually. So this is basically a two-wave study for this question. And interestingly, when we looked at the frequency of concordance and discordance, this is the ever drink variable. Couples are most likely to both say that they drink in this sample. And then the next most common pattern is neither drink. So, but it's most common for couples to be concordant, either drinking or not drinking. And they were asked about their spouse in terms of, like questions I told you about earlier. How much do they make demands on you, criticize you, let you down, or get on your nerves? And we first looked at whether those patterns had implications for marital tension over time. So this is longitudinally, if you in the first wave have a certain pattern of drinking, what's it like over time for your marital tension? And we found that concordant drinkers have lower levels of marital tension than the discordant drinking couples. So this is consistent with the young adult literature that it's important to be concordant drinkers, not concordant non-drinkers, which is also interesting. It's not about concordance necessarily, it's about both drinking. And when we looked to see if it varied between husbands and wives, and we found that it was only important for wives. So wives' levels, their couple patterns had implications for their own opinions about their relationship, whereas husbands were not affected by the couple patterns. So concordant drinking wives reported lower levels of marital tension, meaning that they found their husbands less irritating. Compared to the discordant drinking wives and husband non-drinking. So it seems like it's really important for husbands to be drinking too. Uh, it's fun watching my husband while I give this talk. Uh, so interestingly, it didn't have an effect among husbands. So similar to the research on young couples, concordant drinking couples had the least marital tension, and women in concordant drinking couples had lower levels of tension than the discordant wife drinking husband non-drinking couples. And we don't know why we find these findings, but there's not really in-depth information about whether they're drinking together. Anything about their relationship really besides their marital quality. So we can only speculate. It could be that because of social roles, women are taught to be more concerned with their relationships than men, and they're often referred to the barometer of the marital tie compared to men, and can sense that there's just differences perhaps. It might also be a reaction to deviation from the social or cultural norms to have the wife drinking and the husband not drinking, because it's less socially acceptable for women to drink. So next we look to see whether these drinking patterns affected how long people lived over time in the HRS. And what's really, I think, interesting about this is that when people look at mortality, they often look at individuals' behaviors. So their own individual level of drinking does have an impact on their own mortality. Moderate alcohol use is associated with lower rates of mortality, whereas heavy is consistently associated with higher rates of mortality. And they've often talked about this as a J-shaped curve. So it's not drinking is bad, but heavy drinking is really bad, and moderate to light is good. But there's a big debate in the literature about this, that maybe it's because the people who are sick stop drinking. So it might look like it's bad to not be drinking. But I want to point out that we did control for chronic illnesses in this study, and we found the same effect. And that's all I want to say about that. So what we are interested in seeing is whether we find the same link between drinking as we do with individuals, if we find that when your partner is drinking as well. So we're able to look at the couple, individual drinking and partner drinking, and their own mortality. This is a different sample that we used of the HRS because we didn't have to have the relationship quality. They had to complete at least 3 waves from 1996 and on. And so the average years in the study was 17 years because 42% of them had died by 2016. And we found the same pattern of results in terms of the concordance and discordance in this sample, with the most common pattern being that they both drink, followed by both not drinking. And this is the association between their baseline, whether they ever drink, and their level of mortality. And so the higher lines mean that they live longer. So this is survival instead of mortality. So I'm going to talk about reverse things, but so the higher the line, the longer they survive. We found that couples who both drank had the highest survival rate compared to all the other groups. And so this is similar. So they're less irritated and they live longer. But remember, this is ever drinking. This is not like getting crazy. Okay. Then we looked at average drinks per week. And I think this finding is really interesting too. So this is the individual, or in the marital literature, we often call that the actor. So the actor is affecting their own mortality and the partner is affecting the actor's mortality. This is a curve showing their, this is in the opposite direction, I'm sorry, but this is how long, this is how their likelihood of dying. So if you, and the bottom, the x-axis is the number of drinks per week. So it's pretty bad to drink heavily, but it's bad for you if you drink heavily, and it's also bad for you if your spouse drinks heavily. So I think it's controlling for the individual's own drinking. Your spouse's drinking is affecting mortality. And for both of them, when your own drinking is light to moderate, their own mortality is lower. And when their partner's drinking is light to moderate, their own mortality is lower. So you see the same kind of J-shaped curve among individuals and partners. And next we found a gender effect with the same kind of finding in the previous study, that it tends to affect women's mortality more so than men's. So this is the association between wife's drinks per week and her mortality. It varies by how much the husband is drinking. So her own association is changing depending on what her husband's doing, which I think is really interesting too. So wives' mortality is the lowest in a concordant light moderate drinking couple. And that's a basic finding there is that, and it's really bad to drink heavily for everybody. So overall, this study showed that concordant drinking couples survive longer in terms of the ever drinking. And we don't know why this is. There's a million questions about this. It could reflect broader compatibility in the couple, in their lifestyles and their intimacy. Concordant drinkers are more likely to drink together. And in research that we've done in others, using other samples, when we look at whether people drink together versus drink the same amount with others, it's drinking together that's related to better relationship quality, not when your husband goes to the bar and you're drinking and watching TV. You have to be together. And light drinking is related to better survival rates among both individuals and their partners versus heavy drinking. And it's consistent with the research on individuals. And that wives appear to benefit from drinking concordance in terms of the amount more so than husbands. And so this could be, again, because wives are more concerned about the concordance in their relationships or being the barometer, for instance. So overall, I think these studies show that the effects of drinking on marital quality and health vary depending on the marital context and gender, and couples are most likely to be concordant in their drinking, and that this concordance has positive outcomes. It's associated with lower marital tension and longer lifespan. And that partners drinking can have an important consequence for your health, even controlling for your own drinking. And that it's unclear what the mechanisms are for these links. So one of the things that I do a lot in my lab now is a lot of daily studies and studies looking at within-person associations over days and also among couples. And I think the next step in this literature is to look at what are they doing in a daily life? How much did they drink together? In what context were they drinking? And I often have people wearing ECG monitors and blood pressure monitors, and they wear them in their daily lives. And I think we could really get at what's happening here. How is it? Are they doing leisure activities? Or are they arguing? Or things like that where you can look at within person and within couple change over time. The research, other studies that I'm doing right now are on Alzheimer's and Alzheimer's caregiving and caregiving for people with disabilities. And there's a lot of questions in our studies on alcohol use. And I think it would be interesting to look at alcohol use in that population, especially among couples where one person is developing dementia. How do they, it just would be really interesting to see how do they change their alcohol use patterns? Do they change them? What's the implication for drinking among caregivers? Are they using it as a stress buffer? Or is it bad for them? I think it would be really interesting to look at that. And then we have another area of research that we're getting into on hearing aid use that I mentioned to a few people here that got funded today. Yay! We're looking at hearing aid use among older adults and what influences people to use their hearing aids. And I think the spousal tie is going to come up as a really important tie, either putting them in or taking them out. I think it's going to be really fun to do that study. And I'd like to acknowledge my NIAAA grant collaborators. I couldn't have done it without them. There's people I collaborate with in public health and in psychiatry and ISR. And then, of course, my people in the ABI program. I can't do anything without them, my research assistants and my data analysts and my postdoc. And then, of course, the funding for the alcohol use study and the health and retirement study. And it's publicly available data, so that's available to everybody to study. It's really great resource. Thank you. Do people have questions?
People are have disclaimers or warnings about alcohol use and forced sobriety. Have you looked at that at all or anything of that sort?
Yeah, we don't. Yeah, we don't know why they're not drinking. We don't ask them that. That would be an interesting question. We do control for chronic illnesses, so I mean, we know that part. But yeah, it would be interesting to see, did you choose to do this or not? And then I think people do replace it with other things. And I think looking at marijuana would be really interesting. There's no research on couples and marijuana. No, but I think, yeah,
There is other.
Yes.
Yeah.
And then another thing that people have asked me, like, well, I'm not allowed to drink. What does this mean? Should I just take up drinking? And it's not that. I think it's just doing something together that you both like to do is basically the key. Any other questions?
I have more of a comment. So my grandfather worked for the party for life. With the light moderate drinker, life on water, entire life, probably half the age of 97. So I would say with this knowledge and drinking is possible, I'm rooting for all of us in this room.
Yeah. 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 My grandma lived until she was really old and she drank a lot. And we said that she was just pickled, you know. Yes.
Karen, how did you choose this as a avenue of research? But what was it that made you choose it?
Oh my God, I'm supposed to remember.
Um,
I think, okay. Well, I worked with Tony and James Jackson, her husband, always talked about his theory of affordances. And I never talked to him about this, but I thought his theory of affordances was that Black individuals used health behaviors as a way to reduce stress, which decreased their levels of depression. So Black individuals often look less depressed than white individuals. So they might be using strategies that make you feel better, but in the long run, it kills you. So I thought, well, that's really interesting. You could do things with your spouse that eventually kill you, but you're having fun while you're doing it. I thought that was interesting. And so I like that juxtaposition between something that makes you happy and something that kills you, I think is interesting. And then I also think that his theory might just be about relationships. I think a lot of what we do is bad for us, but it's fun because we do it together. So eating crappy food or smoking cigarettes outside the bar and talking or drinking alcohol with your spouse. It's a way of bonding. So I think, and I've looked at positive interactions in daily life, and it's related to poorer outcomes in the next day, like poorer sleep. And like, so that it made you happy in the moment, but you didn't sleep as well, maybe because you stayed up too late or, yeah. Thank you.
Can you talk a little bit more about the literature study of the research that's done at ISR health of aging people, and if people want to know more about that, they're going to find out more about the study of larger study that ISR has.
Yeah, so there's a website, I think it's called So the HRS has a website that has all their latest media. They put out pamphlets that describe all their findings. There's so much research going on. They also have a huge genetics component now, and we did the genetics in this study too. We were interested in seeing if couples had similar genetics, did that influence their drinking? And I can't remember what the findings were now, but there's just an overwhelming amount of data. They're doing whole blood samples when doing other things, and yeah. Since 1992. Yeah. Yeah. And then if people are interested in doing some new questions, they put out a call for modules, so you can add, you know, if you're accepted, you can add questions to the HRS too. So, yep.
seem to have been big times perhaps on the lighter side and have more positive relationship. They're also taking walks together. They're also running marathons.
Yeah.
People that have who seem to have more difficulty, a physical point of view, completing some other higher level activities.
Yeah. I haven't looked at physical activity. I think that's an interesting idea, though, to do sort of a cluster analysis where you look at all their behaviors together, and maybe there's different typologies of couples that, yeah, I think that would be really interesting. we've looked at waist circumference and stress, but not physical activity. That's interesting. Thank you.
My understanding that some of the revision on the health effects of alcohol have been kind of severely adjusted. From saying, I drink a day for 2 days, partly because of this notion that there were groups being counted among non-drinkers who had been drinkers. I hope I'm getting that right.
Right.
I'm kind of moved through that faster than my brain.
Yeah, sorry.
But you also said you control for that. I'm just curious about all of that right there. Can you elaborate a little bit?
So it's called the sick quitter hypothesis. That the sick quitter, so that people who have chronic illnesses are not allowed to drink, like other people have mentioned, so that they look unhealthy, but it's not because they're not drinking. They started out, they're not allowed to drink. And so this, a lot of the research has suggested that the findings are not correct, that more drinking is better for you. I just took that. It's really simple because I don't know how you actually do it really. You'd have to do like a lab study or something, but I just controlled for the number of chronic illnesses they had. So there's a count of 8 chronic illnesses to see if taking that out made the findings go away, and it didn't. But I think it's because they're not really drinking a lot, at all. So.
How do you control for self-reporting inaccuracy? I hate it when the doctor asks me how many drinks a week you have.
Yeah.
You want to be honest, or do I functional? Is there a male-female difference in that response?
Yeah, I don't know if there's a male-female difference in lying. There might be. Because it's less socially acceptable for women, so they might be more likely to lie. I mean, you also get a lot more grief, I think, but maybe just because I'm a woman, but they start screaming at you about breast cancer. And so I think this is just my idea. I don't really know, but I think it's just a matter of gradation, that you probably say you drink less, but you wouldn't say I'm not drinking at all. Yeah. Yeah. So they were probably finding an effect in the same direction, but maybe not the amount.
I'm a physical therapist, and based on some things that I have seen clinically about older women who according to the subacute alcoholic, there was a woman who was probably having socially 4 or 5 drinks a day, but not acknowledging. He's absolutely, when we ask somebody how many drinks they have in a day, he knows that is on a week when they received they weren't keeping drinking. So that inevitably the number that people reported was high. I mean, that was, I don't know if he had any hard data.
Yeah. Yeah. It seems like we could do some mode comparisons too. Like if you ask them on a web survey, is it different than when you ask them in person? I don't know. Because maybe they're more likely to lie if it's a phone call. I don't know. And we don't have a measure of social desirability. That's the only way we usually control for lying in studies, and I don't really know how accurate that is. Right, and yeah, that's true, because there's all those memes where this is my glass of wine and it's this huge glass. But the other thing, and speaking of like doing device work, I'm starting working with Megan Patrick, who runs the Monitoring the Future study, which is a study of alcohol use over time from the 1970s until now. And there's new monitors you can put on people to find out how much alcohol they're using. She says they're kind of crappy, but I think that that's going to be a new exciting development to see how much people are lying. And maybe what's also interesting is about how fast you do it too. So I see people, they had 2 glasses really fast and they're completely wackadoo. So I think that would be picked up by the monitor. Yep.
and to have them together and over time.
So Angie, my data analyst, just published her first authored paper on this. And so she looked at the pattern of drinking over time among couples. And they're concordant over time. I don't want to say it incorrectly, but what was interesting is that it looked like concordance eventually bites you in the butt over time. Because I look at baseline. Well, it's just that the drinking eventually catches up with you and is related to poor health later on. So, because this study that I'm talking about looked at baseline drinking and change over time and marital tension and mortality. But she looked at change in drinking and link. I don't know how to share articles with you guys, but maybe do you have is there a way to share articles? Yeah. Yeah. Because I don't want to say something incorrectly, but yeah. Yep.
Maybe. If you recommend this topic, we bring to the attention of our members. And if you think we should, do you have any recommendations of how we do it then? Because it's
I think,
a complicated subject for lay bring to the attention of the members that work on.
yeah, and the media is very interested in it too. I think we just have to be careful to say that it's just about ever drinking. Most of the findings that I find, it's like, do you ever drink? It's not drinking a ton, and you're not getting drunk. But that, yeah. So we just have to be careful about that part. But I think people would be interested in it. Okay, thank you.